What an exciting day for this community. Just this exciting day. I want to thank those who have shown up today to help with the ribbon cutting ceremony for something that we've been working on for many years, which is to continue to meet the needs of the West Louisville community in everything that we do. I want to thank the representatives of the Urban League, the leadership from One West, the West End Ministerial Alliance, our own U of L Health board members, and the U of L Health academic chairs. This is a proud and significant day that we're able to continue to meet the needs of opening up access to health care. We've gone through a pandemic that has delayed us a little bit, but we're now they're ready to get going. Serving the underserved, reducing barriers to care, and increasing access is the core of U of L Health. This year we expanded our Urgent Care Plus footprint in a big way, adding 5 locations, this being the 5th in the Parkland neighborhood. The neighbors are here because they're familiar faces with us. Over the last 6 years, more West Louisville residents have turned up to U of L Health for care than any other health system, and we have nearly 700 of our employees who live in this neighborhood. We've invested about $500,000 in this new location, and let me describe Urgent Care Plus. It is both urgent care as well as our primary care office, so we can meet the immediate needs of individuals while also developing a long-term relationship focusing on routine exams, preventative care, and chronic illnesses. This really represents the power of you closest to the home. We are here for you and are glad to be able to meet the needs.
It is so good to be back in the Parkland neighborhood. If you all remember, we were here in March when I told you all this will happen. In a few months, we'll be opening this facility. And time flies, and here we are today. Just please walk through and see how remarkable it is, how beautiful this is. I'd like to thank each and every one of you for being here today. And I especially want to thank our leadership. You heard about so many community organizations, and I'll mention them again in a minute. But I certainly want to acknowledge Congressman John Yarmouth, who's here with us. State Representative Meeks is supposed to be here, and when he does, we will acknowledge his great leadership and support. Mayor Greg Fisher is here, and of course, Councilwoman Green is here. There we go. So thank you all for being here today. What is so special about today is that this Urgent Care Plus location, and the plus, as you heard from Tom, represents the plus in many ways. It's an asset to this community. It is a place that is opening up in a federally designated, medically underserved area. And the plus also means everybody working here is truly committed to the West End. I love that they showed me the cookies are from right here. That's important when we say, so don't forget to grab the cookies. And you like them, go back to the store. Not too many times or you'll have to come back here too often now. But the whole point is that we are all in for the West End. That's important to us. U of L is not a stranger to the West End, as you know. Through the university's signature partnership, we have been active for many years in many aspects of the life of this wonderful community. And of course, we can do nothing on our own. It's always working together with the city, working with JCPS, the United Way, the Urban League, and so many community partners that Tom Miller has already recognized. That's because we know a healthy community certainly needs health equity issues addressed, but it also means access to education, to a good living, to the good life. As I've said many times, this university has seen firsthand, living through the pandemic, the deep chasms that have formed in society. And as a university, we are committed to reducing those barriers, enhancing opportunities, and making it possible for everybody to achieve their full potential. So, for everyone here from the neighborhood, we believe in you. We believe in the strengths of this neighborhood. We believe in the potential of this neighborhood, and we believe in the importance of this neighborhood for the well-being of Louisville and the Commonwealth. So very, very, very happy to be here. I know that you will meet Dr. Evans and her tremendous team. I told her earlier that meeting her, listening to her speak in March, I was like, I could listen to this woman speak for hours. She's extraordinary. And the passion they show for their work and their community is so evident, and it's so inspiring. And I know that under the leadership of Dr. Evans and the whole leadership team, we will make sure that the residents of Parkland and the surrounding areas have access to the best care they can get anywhere. Now, the beauty of being the president is that I can take some small liberties. So what I want to do is acknowledge not just Dr. Evans's husband, who is here, Rodney, but also as a mom and grandmom, I think it's really important that you always remember the parents and the family that are here. Would everybody please applaud Dr. Evans's family that's here? So mom and dad are beaming, I can tell you, looking from here. That's great. That's what we mean by the Cardinal family. We really are all in. We look out for one another.
Good afternoon, everybody. It's great to be here for what is truly a landmark event in this community, and particularly in the neighborhood of West Louisville. You know, Neely mentioned the federally designated underserved areas that this facility is sitting in. When you think about, I'm going to get into a real hornet's nest now, but the current debate over critical race theory, and you think about the systemic way in which neighborhoods had been segregated and resources denied to certain neighborhoods, and the health disparities and economic disparities and opportunity disparities that have existed, all because of laws that were written, you realize that this kind of result, where neighborhoods do not have access to quality emergency health care, it's part of this whole issue that we as a country need to confront. And I'm so proud of U of L Health and the university for taking the initiative to actually confront this glaring lack in our community, and the life-saving care that this facility will provide in the future. It is truly something that we can all be grateful for and all be proud of. This is the 5th Urgent Care Plus facility that U of L Health has opened in just the last year, and what we've seen, again, through the pandemic, the desperate need for not just the access to quality care, which has been lacking to so many, but also the advocacy that a facility like this can provide in terms of providing information about vaccinations for COVID and other healthy lifestyle advice and so forth. So many things that every community needs, every neighborhood needs. So once again, congratulations to U of L Health, Tom, Neely, Dr. Evans. All of you are owed a true debt of gratitude for this community, and we are very grateful for what you have done.
Someone else who has helped us during this pandemic, I can't say enough about. He is the mayor of Louisville. He has helped us do 150,000 vaccinations in this community through the work of the Department of Health, and he truly has been our partner in the health of this community. I'm glad to introduce and ask him to come forward, Dr. Mayor Fisher.
Well, I've been called worse things, that's for sure, so I appreciate that. Well, thanks everybody, and welcome. I do want to recognize a few folks here. Nicole Yates is here with Passport Health. You know, she and I worked together in my office for a long time, so we appreciate your good community work here, Nicole, very much. Dr. Mark Burns is over here, and Dr. Burns, talk about a hero helping us get through the pandemic. You were amazing in terms of a resource to the community. So you were available anytime to speak to people, and you really helped our city hopefully get through this pandemic. And I want to recognize Councilwoman Green. She's here, and a special friend of mine, Zion Green, who's Councilwoman's son, a great man. Zion, would you like to join me for my remarks up here, please? We won't get you on TV tonight, man, okay? Zion and I have been pals for 8 to 10 years or so, and he's grown quite a bit, so I'm just hoping he hangs with me for the next 17 months or so, all right? You good with that? You got me? Okay, thank you, buddy. So before we get into the remarks a little bit, and I promise to be brief, but this is a historic location where we're at right now. 28th Street, 1968. This was the heart of Louisville's civil rights movement that was taking place after the assassination of Dr. Martin Luther King. Across the street from us here, we got one of the famous Carnegie libraries that's here that has $500,000 in the budget, this capital budget, thanks to Councilwoman Green and maybe myself a little bit too, to return this into a broader community asset than what it is right now. When you look down the street here, you see Brightside's community tree planting efforts come into fruition, Parkland Plaza right behind us here as well, and then Dare to Care's moved their headquarters just a block that way as well. So Parkland is really coming along in a really positive way. And when you put today's announcement here with it as well, you're starting to see the type of community building that we want to see time and time again in our city. And as everybody knows, health is one of our core city values. Compassion, lifelong learning, health. So bringing health to every neighborhood is particularly important. And it's wonderful that U of L is doing this, who is the essential partner to make so much of this happen, because facts don't lie. And the fact is that for the average Louisvillian, and it's hard to say what average is, but for the average Louisvillian who lives near Shawnee Park, their life will be 12 years less than the average Louisvillian that lives near Tom Sawyer Park. And that's just not right. Okay, and there's all kinds of reasons for that, but access to good quality health care is one of those reasons, and that's one of the reasons why today's announcement is so important. So I'm really thankful to U of L Health for locating here to help close those gaps and help people realize their full human potential. That's how we define compassion here in our city. Parkland also produced Louisville's most famous person ever. And Zion, do you know who that would be behind you? No, behind you being famous. Who's the other most famous person here? Muhammad Ali.
Oh, yeah. The boxer.
The boxer, Muhammad Ali, that's right. So this is a rightly proud neighborhood, but it has suffered from historic challenges of the past. When you think about Jim Crow, when you think about redlining, when you think about a lack of opportunity. So you got to be healthy, right? If you don't have healthy body, you don't have healthy mind, it's just really hard to show up and get things done. So really important announcement here today. And one last plug, Dr. Burns, you'd be disappointed in me if I didn't say, if you're not vaccinated, please get vaccinated now. Okay, this Delta variant, that's good. I've got an applause line on vaccinations. This Delta variant, for areas of our country that have not vaccinated effectively, it is raging through those neighborhoods right now. And we know way too much about this virus to let that happen here. So please, these vaccines are safe. It's the best way to protect yourself and your family. We had about 170 people on Saturday get vaccinated at Chickasaw Park with the NAACP's event. So a lot of people are just saying, okay, I'm ready. So if you got any questions, please check with your healthcare professionals. Please check in right here that we'll have access to testing and vaccines to make yourself better. So with that, I say congratulations, Dr. Miller and Dr. Evans. Got a proclamation for you to throw up inside on behalf of our future of our city, so that you can put that up proudly in your clinic, okay? All right.
Thank you, Brian. No problem.
I also want to recognize Representative Meeks, who is not here at this time. He wanted to be here, but he could not. But I also want to recognize somebody else, Senator Gerald Neal, who also has provided a proclamation to be displayed here. The collective dedication and hard work of its staff and administration working tirelessly to protect and improve the health care of this community. If you'll display that proudly, we would greatly appreciate that.
Thank you.
Thank you. And I'm also honored to introduce another person who has been so dedicated to this community and the health of this community.
Welcome everybody to beautiful District 1. It is truly a great day in the neighborhood. And I said at the groundbreaking that projects like this are true anti-racist acts. It is about putting our money where our mouth is. And so I grew up in the Chickasaw neighborhood, not too far from here. Currently reside with my family in the Park Duval neighborhood. And so I used to grow up hearing about how Parkland used to be a thriving neighborhood that was a hub of activity. I had no recollection of any of that, but I am so thrilled about the fact that my children, you all met my son Zion, will have the opportunity to live in a world where Parkland is thriving. And so I am proud of the investments that the city has made in the Parkland neighborhood since I've been in office. You see Dare to Care to my left. The mayor talked about the library right across the street. Do know that I will continue to ride everybody's back until we are fully funded, and we will be looking for federal funding to get the library back open. But we are here in another integral piece of the puzzle. And so I look forward to the fact in the day now when I can bring my children here and my family here, because there is a cost and tax to being poor and black in this city. We've got to drive across the bridge to get health care. We've got to go out east, or we've got to go downtown. And so it is truly a new day in the neighborhood. This facility is less than 5 minutes from my home. And so this is personal. Dr. Evans, we are thrilled to have you here. I know her passion is for the people. The people will come. And so all power to the people. It's a good day in the hood.
The success of an organization is not the bricks and mortar, but it's the people behind that make a difference. And I know you heard her talk if you were here when we started this. She is going to make a difference in the health of this community alone. She's going to make a difference. But she also has a team of people who are working with her. I'm proud to introduce Dr. Tamaya Evans.
Well, thank you. I'm so honored to be able to serve, but I want to thank my staff, from the head of the university down to our front office staff, to Christina, who's helped bring this to fruition, to Dr. Reisert, to all the staff people who are in my office. And I'm drawing a blank on everybody's names right now, but I will tell you, they have the same passion I have. I literally know that I was built to do this. And I came from Flint, and that tells you a lot about me. I got my family here, so I am a little more nervous than I normally am when I speak. But when I was younger, my aunts, and my Aunt Peggy is here today. I told her she's in my remarks because she and my Aunt Helen used to tell me about how poor doctors they had, and that I should do this better. So when I come here, I want to give what I couldn't give to my aunts, but I can give it to a community of people, and that is quality care. Martin Luther King said that of all the forms of inequality and injustice in healthcare is the most shocking and the most inhumane, because it often results in physical death. When we talk about serving these communities, this community, Parkland, and the surrounding areas, the least of these doesn't mean that everyone's poor and downtrodden. There can be some poor and downtrodden people here. But what the poor and what the least of these, I guess I need to let him pass by. What the least of these are about people being in need. They need health care. They need quality health care. They need us to move those mountains that they talked about in health disparities. So this is a part of that movement, to move those mountains and help people who need health care. It is a shame when, like you said, that critical race theory, bringing that up, that's an awesome point, because the structural racism speaks nothing to the heart of man, but it speaks to what we put in place back in a day where we wanted to separate people, and now we see the impacts in our healthcare. So we want to fix those inequities by putting something that gives people true access to not just urgent care, but to good primary care. If someone has to drive miles, those miles feel like mountains, and I've said that before. And so they miss out on their primary care, their preventive care. I would rather see someone as a pre-diabetic where I can make a difference in their life versus meeting them in the hospital where care is more expensive. They are on their deathbeds, and diabetic ketoacidosis, I know I'm not supposed to use those big words, but that's what happens when someone doesn't meet their basic daily health care needs. They end up in the hospital. So we want to reduce that by helping people day to day. For the working people who need to go to their jobs and don't need to spend hours in the ER, they can come here and they can get that ankle sprain taken care of. They can take care of some of their easiest parts of their health that don't require many, many hours. Imagine if you have to work, but you have a simple problem, but you have to go downtown and spend 5 hours in an ER. That's money out your family's pocket. So it impacts us in so many ways to have health care in our neighborhoods. And so one of the things that I want to impress upon you guys, when I talk about the least of these, I coined a little phrase, I guess. I didn't realize I was doing it, but I just said, bring the best to the West. And that's not just put a little window dressing on this, open a clinic. Let's make it a high quality clinic. Let's make it a partnership. We want to partner with Dare to Care. We want to partner with everyone in this community to make this a vibrant community of good health, good information, and also one that actually helps impact the lives of the people here. So when you look here, you're going to see that we are true partners. By opening this, we are investing in this community. And at the end of the day, we are going to, on Virginia Avenue, we are going to be here when you need us. And we are going to everyday work to give the best to the West. I didn't get to take y'all to church today because I'm a little nervous, but it's hot out here. But in Matthew 25, it just says that we have to make sure we take care of the least of these. You do that, you take care of all of us. This is our city. All of us, even you, if you don't live here, this is your city. And we have to start embracing all parts of Louisville as our city. And I love that the mayor, the congressman, University of Louisville are now investing in this part of town. And I'm super, super excited. And I thank you all for the opportunity.
If you don't have a primary care doctor, she's seeing patients today. They saw 100 patients last week. And also, one of the best is a gentleman who's in the back who's also supported us, Representative Meeks. Would you raise your hand? Thank you for being here and helping support us. We greatly appreciate it. This is going to be a new day in healthcare in this part of the community, and we appreciate your support.